Today we're going to be talking about the shocking murder of Brian Thompson, the CEO of United Health, and the rackets that have been run on Americans and why so many Americans are pissed off about how they've been treated. Hello everyone, Dr. Chris Martinson to Peak Prosperity here. Let's go right into it. The Thompson murder and the aftershocks. Why are people so angry? So this is the murder that happened on the streets of New York. There's Brian Thompson walking. An assassin walks up behind him, cycles the gun, cycles the gun, cycles the gun. It's a specialized gun. Goes up, finishes the job. Then rode off on an electric bike and been a big manhunt ever since. There's a good chance that he has been found, according to the New York Post, who originally said closing in, but now they're saying person of interest in fatal shooting, caught with a manifesto. Be interesting to see if they release that. A gun that matches the gun that they're seeing, and you just saw in that video right there, and fake IDs, and somehow caught it in McDonald's. I'm not sure how you get caught using a fake ID at a McDonald's, but at any rate, they have somebody in custody, so we'll see if it is the person who did this. Now, checking in on the national pulse about this murder, shockingly, the national carometer was like less than zero at this point. You saw the memes come up, you're talking about acute lead poisoning deemed a pre-existing condition, claim denied. Here's why you get memes like that, because claim denial rates by insurance company, UHC, which is his Brian Thompson's company there, a 32% denial rate. It's just horrifyingly bad. What they've done as an insurance company is they use some AI to just deny people coverage, right? And they run it. It's a business model to them. They know that if they make the gauntlet hard enough, particularly for people who are sick, particularly if you're sick with like cancer, they know you're just worn out and you don't have the energy to fight them. They're just going to make the process as hard as possible so that you'll give up. And that way it's more money for them. Okay. Now, tracking the public mood here, we see that even top internet sleuths say they're not going to help find the United Healthcare CEO killer. Normally, excuse me, there's all these TikTok users, Reddit users, incredibly good at locating people and figuring stuff out. This time they said, nah, we're not going to help on this. So what is causing this national mood? What nerve got touched? Why are people so angry? Well, it's because of this chart right here. This is a crime chart right here. The United States, and let me get my pointer out, clocking in here with by far the most expensive spending for healthcare and the worst outcome, the lowest life expectancy of any industrialized country. Many countries are spending, this would be half. This is the half line. They're spending less than half per capita. $10,000 per person on healthcare in the United States. How can it be that we're spending twice as much and having worse outcomes? Well, I'll tell you how. It's because we had this revolving door going on here where you had Mark McClellan left the FDA, and now he's over with Johnson & Johnson. Scott Gottlieb, horrifyingly bad human being, former FDA commissioner, now in charge of, he's on they say regulating Pfizer, but now he's on the board of members at Pfizer. You got Stephen Hahn there, was former FDA commissioner in charge of regulating Moderna, now sitting over there as the chief medical officer of a venture capital firm that's behind Moderna. James C. Smith left as the CEO of Reuters. On the left, he is the CEO of Reuters, also is a current member of the board of directors of Pfizer. Reuters, that company that was busy poo-pooing all the ivermectin and the dissident doctors who were busy figuring out how to make COVID go away. Obviously, conflict of interest there. And then, of course, Anthony Fauci. It's terrible. These people like these people, this chart right here is such an emergency. Anybody who is not completely corrupt, who's been involved, who was in charge of this show right here, should have looked at this chart and said, we can do a lot better. But they didn't. They didn't care. What they wanted to do was perpetuate a system that brings you this. And then ultimately, when there's some consequences for this, you find that the carometer is pegged at zero. Okay? So this chart is a crime scene. 100%. This is corruption. It's bad. These are people's lives. This is awful. In a nation of 320 million people, 330 million people, this many years lost represent billions of person years shaved off. Okay. And this is average life expectancy. So a lot of people are dying less than that and older than that, right? It's terrible. And it was brought to you by people like this. These people and other people just like them. So now let's just look at this over time and ask the question. Great chart here by Eagley. And I don't think we need the sound on this one. Let's just turn that way down. So you can see here we are in 1980, around 1985, when we started to introduce seed oils and GMOs and glyphosate, something started to go bad on the U.S. here. But then right around 2014, things really take a turn for the worse here in terms of losing ground on life expectancy and then paying a lot more. And here you can already see, like, we're way out of league with every other country out there, both in terms of cost and outcome. Here comes 2014. What happened? Look at this. Zoom. The UN stuff starts really peeling away here. Whoa, what's happening? There's a little COVID jigger-jagger right there. So what was that? Are you tired of feeling run down, maybe low energy? You know you've got some pounds you'd like to lose. Maybe you've got brain fog or something like that. Listen, we think we have the answer to all of that, and it begins with your food. If you're like me, you were shocked to hear testimony recently that unraveled and unearthed and exposed the idea that our food has been made addictive by addiction specialist scientists, the tobacco scientists out there putting things in our food. Maybe it also shocked you to discover that Europe does not allow all kinds of stuff in our food because they know it's toxic. What is the combined effect of all of this? Listen, we know what the data is. It's horrifying. The number of children showing up with type 2 diabetes, the total metabolic disasters unfolding across the land, marked by obesity, sure, but we have cardiovascular issues, concomitant rises in cancers, all of these things, and it all starts with food. Garbage in, garbage out. So what do we do about that? First, it begins with understanding the context. We've put together a very exciting, comprehensive food webinar that will expose the regulatory side of this and what is being done and why and how this happened to us. We'll be talking with Thomas Massey about that. We've got Dr. Ken Berry talking with us on the practitioner side and the solution side. We've got Tracy Thurman talking to us about the war on farmers and the war on food that has been happening. And Robert Barnes to help us to understand that as well. Many, many other guests to both define what the problem is and what we can do about it. And we want to make it as simple as possible. Here's an example. Tortillas. Hey, maybe you're even on keto and these are carb-wise. So these have low amounts of carbs. See that? Carb-wise. Yeah, these are carb-wise, so keto-friendly. I want to note something. You see how fresh these look? Yeah? You see any mold in there? Any bacteria, any yeast, any sign of anything, any organism in there? These things expired in June and it is now November. So, what are they putting in our food that even black mold won't eat it? I don't know, but I've decided that if it's not good enough for black mold, it's no longer good enough for me. Once you start down that path, you realize that we have got sugar and preservatives and salt and seed oils, all of the chemicals that are unnecessary, and the fact that the food pyramid is absolutely wrong. So if you like effective information that leads to effective action, this webinar is for you. It's going to be the usual thing that my team and I will put on. It'll be organized, digestible, easily understandable, and most importantly, it's going to be actionable in ways that you will understand what to do. And I've designed it so that you would easily be able to send this to anybody that you love or care about, say, can we talk about this, and have it as a starting point for conversation. But what we really want, we want you to be healthy because, well, who doesn't want to be healthy? Health is the number one form of personal capital you can have, of course. But given everything that's going on in the world, being healthy and vigorous and active are going to be dominant strategies and things you're really going to want to be carrying in. So, folks, it's time to get prepared on all levels. It begins here. It starts at home. It begins with our eating. And let's just make sure that we're not eating stuff that even black mold won't touch. With that, thank you very much for listening, and we'll get back to our regular programming now. Bye-bye. What happened there? Well, this is a pretty easy story to tell. So let me get this up here and pull up this. Here's the stock price of United Health Group, okay, UNH. Here's a 20-year chart. Obamacare phased in there. It was passed in 2010, but it really phased in 2014. That black arrow is pointing at 2014. So you can see the stock price basically went from 65 to 525 is like a 9-bagger right there. And that's tracking the healthcare misery. Now, if you want to see something really horrifying, just read all the people's accounts of what happened when they were denied healthcare, how hard they had to fight, just how miserable the experience was. These people right here in this healthcare racket, it's a sick care racket, right? It's the hospitals, it's the pharma companies, it's the health insurers in cahoots in a giant cartel of sick care with, of course, your erstwhile congressmen and senators supporting the whole thing, pocketing chump change in comparison to the misery that they are fostering and perpetuating. So that's what people are so mad about. It's not that hard to understand, right? You know, memes like this one, breaking news, witness unable to give any identifying information on New York City shooter of CEO. Funny story. United actually declined to cover my new glasses, says witness. You know, it's a joke, right? It's a meme around this. But this is a straight up disaster for American households. This is premiums for single and family coverage. Let's look at the top line, family coverage, because I've been a victim of this all the way through, as have you probably, almost guaranteed. How do you go from $5,700 to $24,000 over this period of time? This is just grotesque. Every single year, it just goes up and up, never stops. When they told you inflation was low or under 2%, remember for a while there, the Fed was worrying that inflation was too low. That's because they don't count this properly. According to the Bureau of Lying Statistics, labor statistics at the U.S. government, actually, they said last year, health insurance costs, premium costs went down. They didn't. They went up by a lot. So how do they do that? By lying. It's just pure lying. And people are tired of it. And this is what the lying actually looks like when you sort of parse it out a little bit. Overall inflation, they claim, was 19% over this 10-year run right here. Workers' earnings went up 27%. Yay. Family premiums went up 55%. But of course, that's just the premiums, and the deductibles went up 111%. As you know, you now have to, in my case, even if you buy a bronze plan, you might be out $20,000 before the insurance even kicks in. And that's on top of the premiums you had to pay. So average families now are going to be out anywhere from $20,000 to $30,000 before meaningful coverage kicks in. And of course, they're going to deny as much of that as they can. So let's imagine for a moment that, let's be generous. Let's say it's only, make the math simple. It's only $20,000 per family for coverage. Now, that's simple math. Well, here looking at United Health Group, not just Brian Thompson, who was earning $10 million per year. I bet you could find somebody to do his job for $400,000 and do it just as well. But don't forget, there's Dirk McMahon here, chief operating officer, pulling $16 million. And you got Andrew Whitty yanking down $23 million. When you add all these up and divide by $20,000, it means that you need 3,610 families forking over $20,000 each just to pay this compensation. You can see it's cash and also equity over here. So that seems like a lot. 3,600 families forking over $20,000 each just to pay for the salaries of these 5 people. That's what makes people angry. Really? We're being immiserated. We're being treated like we're just cows. A whole racket is being run on us. It's a sick care racket. It is a huge sick care racket. And that's what that first chart I showed you absolutely demonstrates, right? This is a racket. You can see, there it is, right there. It's delivering terrible returns, and it's twice as expensive as anybody else. That's a racket. That's how you can detect a racket. Right there. Okay? Okay, so, wow, 3,600 families. Okay. Well, actually, it's worse than that at UHC. I went to their 2023 10K here statement at the SEC, and it turns out they use little numbers like 21. I had to go to page 69 for their equity plans for their executives and equity compensation plans. Number of securities to be issued upon 21 million shares. And they say the strike price is $320. Well, the current stock price is 548. So 21 million times 548 minus 320, which is the strike, that's 4.8 billion. All right, now we take $20,000 divided into 4.8 billion, and that's 239,000 families have to fork over 20 grand each to pay for the stock comp for this one company. This is disgusting. That's what people are mad about. But it's not just it's hospitals, 20 largest U.S. so-called nonprofit hospitals. Really, how are these CEOs' top exec salaries 6 million, 13 million, 17 million, 2.9, 10.9, 2.8, 4.1? Look at this. How are these people worth that many dollars? There aren't that many industries that can afford to pay out top dollars like this. Well, it's because we're caught in a racket. Obamacare enforced this idea that everybody has to buy this stuff. And that helped, of course, as I showed you, the stock price just skyrocketing after that because it enforced this massive expenditure. The United States is expending about 20% of its GDP on healthcare, but it isn't healthcare because it's giving us terrible returns. And somehow there's enough money floating around that just regular old grubby CEOs of hospitals are yanking in anywhere from 2.9 to 20 million bucks here. Almost. Well, 17.4. Really? Why would a CEO of a hospital be worth that much money? What do they do to generate that kind of pay? Nothing, honestly, really. This is just disgusting. So when you look at these things at Molina Healthcare or CVS or Cigna, Elevance Health, United Health Group here, Andrew Whitty is 20 million here, Humana and Centene. You see the CEOs here, their average compensation, their 2022 compensation, again, at 20 grand each. That's anywhere from 650 to 1,115 families just to support each one of these. This person down here would be 650 families have to fork over 20 grand. And for Molina Healthcare, Joseph Zubretsky, they have to, as 1,115 families. That's just, it's atrocious. There's not a single way you can justify that, right? And of course, this is why you are probably being paid less at work over time, because from 2010 to 2020, there was went from 13,000 to 21,000 with companies picking up the lion's share. That you may have only seen this part, but this part is what the company's experiencing, and this is why you're getting paid less. Just because it's hidden, oh, I have a good health plan at work, that feels good. It shouldn't. This is what's actually happening, and that means you're getting paid less because all your money is going to these people. They are not worth this amount of money. Nobody is. Not to administrate the overhead of a system, because none of these people provide any health care. They do Zippo. None of these companies provide any health care. They just administrate. This is the administrative layer. This is just mostly people in cubicles denying claims, and these people vacuuming huge amounts of money out of that system. These people vacuuming huge amounts of money. So when you go in to a hospital and you're like, why does it cost $18,000 for one stitch in a little pinky finger? It's because of this. It's because it costs, because this, when they say, oh, it's so expensive to get health care to people, it's not. Nurses aren't getting paid the big bucks like that. The stitches don't cost that much, but they do once you factor in this. That's why people are angry. So the first response from the healthcare industry has been this. They removed their executive bios and images from their website. So message was received there, obviously. And this is what they went for. Now, guess what? The government cartel paid billions to Walgreens and CVS not to fill ivermectin. Maybe CVS is removing their photos, maybe because of their policies, right? These were totally indefensible policies that we saw during COVID that led to this particular disaster right here. So that's the first response, but I have a different response for these folks. Okay, I'm asking them to consider something else. How about we try these things instead? I think taking your photos off your website is a good first step, but how about the healthcare system folks? Try this instead. How about this? How about don't be greedy, right? I know that all your peers take 5, 10, 15, 20 million and you want to keep up with them, but why don't you just sit down and just ask, how much is enough, right? How much should these top people really be siphoning off? And should they be rewarded for siphoning off that amount because what they did was they figured out clever ways to block people from making claims, right? That's not what this business was supposed to be about. That's not how it started. It's lost the way entirely. United States citizens were tired of having rackets run on us, which brings us to point 2. How about this? How about just provide a great service? Just that. How about that? Instead of rewarding yourself on the basis of how many people you got to give up their claims along the way, how about you reward yourself for having great customer service and people really admiring you and loving you in the community and feeling good about you? And how about major corporations stop running rackets on U.S. citizens? That would be great. And by the way, don't have time for this story today, but the longer story is, you want to know who's running the biggest racket of them all? That outfit right there, that little building at the top. Charlie Bilello writing here on December 6th, stocks, all-time highs, home prices, all-time highs, Bitcoin, all-time highs, national debt, all-time highs, core inflation running over 3% for 42 months straight. It's just damaging people like crazy. And you know what the Fed's going to do? They're going to cut rates again. Why? Because they're running a gigantic racket on U.S. citizens. And this one is also very harmful. This is what people are starting to figure out. This is what we're starting to unearth. This is what has led to that great upwelling of anger. That's why the carometer is at 0. And I think there's an important message here for everybody, which is, listen, can we just stop this? How about we get back to this idea that we're all in this together, that you're not here to just siphon as much money from as many rubes as you possibly can. Maybe some of you are, but everybody shouldn't be. It's time to recognize our system is broken and to get back to something where it's not broken. All right, now I'm going to turn to this with my subscribers back at Peak Prosperity. Syria falls, Israel bombs, Christians abandoned in Syria, Romania denied, Libya again. There's really big things happening on the geopolitical front. Hard to even make sense of it all. So that's what I'm going to be talking about at Peak Prosperity on the remainder of this scouting report. For everybody else, I hope you've enjoyed this. We'll see you next time when we come out with our next piece. But again, just keep an eye on what's going on out there with the national mood, because it's getting ugly, but for understandable reasons. There are things that are legitimately worth being angry about right now. And I get it. With that, thank you very much. Chris Martinson of Peak Prosperity. We'll see you next time.